Good morning, and thanks for joining us here today. I want to thank our Health Commissioner, Dr. Mysheika Roberts, our Human Resources Director, Nikki Brandon, and our Interim Director of Recreation and Parks, Paul Rakowski, for joining us and for all of the work and the work of the entire Cabinet during this time. Rapidly changing circumstances surrounding COVID-19 have caused great concern and raised many questions from the general public and our city employees. But let me start with some assurances from the Director General of the World Health Organization. We are not at the mercy of this virus. The great advantage we have is that the decisions we all make as governments, businesses, communities, families, and individuals can influence the trajectory of this epidemic. The decisions that Governor DeWine and Dr. Amy Acton have made to reduce the spread of the infection and protect our residents. What we do today as a city will greatly impact the length and severity of an outbreak in Columbus. Columbus has tools to help us implement the state orders. I've asked our Board of Health to consider issuing a local public health emergency in the coming days. While we do not currently have any confirmed cases of COVID-19 in Columbus, it is necessary that when we do, and it is when, not if, our Health Commissioner, Dr. Mysheika Roberts, is empowered with all the tools at her disposal to ensure the health and safety of our residents. This time I'll let Dr. Mysheika Roberts explain the specifics of a local public health emergency. Dr. Roberts?
Thank you so much, Mayor Ginther, and thank you all of you for joining us this afternoon. These are really unprecedented times, and we are doing everything in our power to protect the health and safety of all of our residents. Our public health response to COVID-19 has been multi-layered. Columbus Public Health is building on yesterday's orders of the state to use all the resources available to us to limit the spread of this highly infectious disease. To that end, Columbus Public Health will convene an emergency meeting today at 2 p.m. The Board of Health will convene an emergency meeting at 2 p.m. to vote on declaring a local public health emergency. This declaration is important because it will give us additional safety measures now before we need them. As the mayor said, it is not a matter of if, but when. First, as Health Commissioner, I can quarantine and isolate individuals, including city employees if necessary. Most people who work with us when we ask them to be quarantined or isolated, but sometimes we run into difficult situations where people are resistant. But if needed, in the event that someone is not cooperative, this order allows us to take additional steps as a city to quarantine and isolate individuals. As a last resort, and I must say, as a last resort, it could also include placing a police officer outside the door to ensure that the person complies with our orders. Second, the local public health emergency mandates testing and treatment to ensure people are getting appropriate care. This could include ordering medical examinations and treatment and quarantine individuals who refuse exams. Also, it will allow us to control and limit ingress and egress to and from public areas, including determining the routes, modes of transportation, and destinations to evacuate people or provide emergency services. This third provision is especially important to prevent a hotspot of disease in a building, a facility, or neighborhoods to prevent spreading it beyond that specific location. There is no better example of that right now than what we're seeing in New Rochelle, New York, a suburb of New York City, where there is a 1-mile coronavirus containment zone following an outbreak of dozens of cases related to a house of worship. Large gatherings in the area are prohibited. Schools, houses of worship, and other buildings will be closed for 2 weeks to promote social distancing and allow for deep cleaning. That's in New Rochelle, New York. That containment zone is designed and necessary to slow the progression of this disease. While we don't need these emergency powers now, it is important to have them in place before we do need them. This is part of our community planning and preparation for this epidemic, which is now a worldwide pandemic. We have said all along that it's not a matter of if, but when we get a case here in Columbus or Worthington, which Columbus Public Health also covers their public health services. We're preparing for the worst, but hoping for the best. But we must be prepared with every resource that is available to us. We are committed to protecting the health and safety of our residents, and we will do whatever it takes. Declaring a local public health emergency now allows us to be ready when we get the first case in our community, and it gives us additional tools and resources to slow the spread of the transmission of this very contagious virus. As Health Commissioner, I am grateful to the support of our state leaders, Mayor Ginther, and all of our healthcare systems and partners. Protecting public health requires all of us working together. We have a great team in place, and we are working 24/7 on COVID-19 to protect our residents, our visitors, and our community. Thank you. Mayor Ginther?
Thank you, Dr. Roberts. I appreciate your ongoing guidance and leadership. The city has another tool that we can implement, which would be for me as mayor to declare a state of emergency. Let me be clear, I am not doing that today. But in the event we would need to take extra precautions in the coming days, a state of emergency would allow the city to require non-essential city employees to not report to work. The majority of city employees are working on the front lines in our neighborhoods: first responders, public health nurses, code enforcement officers, building inspectors, community health workers, just to name a few. And one of my responsibilities as mayor is to look out for the health and well-being of our city employees who work tirelessly every day in service to our community. I've asked our directors from each city department to take proactive measures to promote the health and safety of the public and employees alike. They are identifying essential and non-essential personnel, and our Department of Technology is working to maximize the city's capacity to allow employees to work from home where applicable, and if that should become necessary. Our Human Resources Department will work with supervisors and employees under the terms of their respective collective bargaining contracts to make certain employees may take leave as necessary. No city employee will be disciplined for absence without leave for reasons related to a COVID-19 event. In addition, insurance copays for COVID-19 related treatment will be waived by the city. International travel for city employees is prohibited. Domestic travel will be limited to mission-critical travel and approved case by case. These travel restrictions do not apply to personal travel. While travel may be limited, the city is working to promote the use of other technologies, such as web conferencing, to allow employees to continue to collaborate, if not in person, virtually. Be assured that the police and fire are reviewing current policies and procedures to ensure that we keep our officers and firefighters safe, and in turn, keep them in a position where they can respond to the community's needs. Many companies are already directing employees to work from home. I applaud and encourage those efforts, and encourage other businesses to evaluate what is possible for their employees. I've also asked our directors to assess their operations and determine what adjustments, if any, need to be made. In an effort to prevent the spread of COVID-19 virus, the Columbus Department of Public Utilities is suspending water shutoffs through April 15th. The ability to wash hands is essential to protecting residents and families from the virus. In addition, the department will also cease power shutoffs through April 15th. These are extraordinary times. Water and power will help Columbus area families cope with the global pandemic. And finally, we will be closing all of our recreation centers and canceling all program to close of business today. In order to best advocate for social distancing, this is critical in reducing the spread of COVID-19. The centers will remain closed through April 3rd to coincide with the state's closure of schools. We stand ready to work with Columbus City Schools and other partners to help meet the basic needs of the residents impacted by these decisions. As many of you know, we are one of the largest sponsors in the state for a summer meal program and work with Columbus City Schools and other partners in the community to provide after-school meals during the school year. We're exploring options right now on how we could partner with the schools and other service providers to make sure that we are feeding children during this extended break. It may be different than we've done it before, but we have to ensure the basic needs of our community are being met during this time. While you've heard it repeatedly, it bears stating again. Wash your hands frequently, cover your cough or sneeze, and stay home if you're sick. As uncertain, disruptive, and inconvenient as these times are, the health and safety of city employees and our community is my top priority. Together, we will work through these unprecedented challenges. But I remind everyone, be kind, be patient, be flexible. I'd invite our Interim Director of Recreation and Parks and our Director of Human Resources to join us, and Dr. Roberts and I and the rest of the team will be happy to take any questions you might have.
Mayor, how will City Council operate? Will you allow the public to attend City Council meetings? Will the council members still be meeting in council chambers during this time?
I believe that there's already been put restrictions on attendance for Monday evening. Is that right? There is a council meeting scheduled for Monday at 5 o'clock, but I think it has been limited in how many folks, trying to follow the guidance about large gatherings, and that's been articulated by the governor to be limited to 100. So making sure that the press is there, obviously, to cover the meeting, but limiting the amount of folks that will be attending.
What kind of solutions will you be looking at in terms of providing those after-school meals that we'll be having? What kind of things will you provide?
Well, I think what's really important for us to help the community wrap their mind around, we really need to focus on the basic needs of those in our community. And so as much as we'd like to provide programming and all the other types of things, based on what we know and the guidance from public health officials, we really need to focus on basic needs. So as opposed to those after-school meals being provided in rec centers and sites around the city during the summer, we have a vehicle, an old food truck. We call it the strawberry truck that Rec and Parks has, and we take that around the city. That might be a different way. I was talking this morning with Joanne Pickerton from CODA and talking to her about what other options can we bring to bear to get food to children and families where they are, as opposed to having large gatherings. And had the same conversation. Dr. Roberts and I were on a conference call with faith leaders just before we came in here today, and many of the places of worship in our community provide those free community meals that are an essential need in our community. And how can we think about doing those differently, offering them, packaging them up to go and providing that essential food to folks in the community. But just thinking about delivering meeting those basic needs in ways different than maybe we have in the past.
There are some other cities that are declaring a moratorium on evictions during this time. Can you work with the municipal court to achieve that?
that's something that we've been working on very hard with under the leadership of the Women's Commission and the Clerk of Courts and the judges, and something that I'm certainly willing to work on and see if we can. Family stability, basic needs. I mean, this is where our focus needs to be during this incredible time of disruption.
So are preschools not part of any shutdown order, so all K through 16 options are not shut down, but preschools are going to remain open, will be allowed to remain open, even though many are shutting down?
Per the governor's order, that is correct.
Is there a logic behind that?
Could you use the mic?
Could you use the mic? Yeah, sorry.
The question was, are preschools affected by the governor's orders of K through 12 as well as higher education? And I have not seen the order yet, but is my understanding that preschools are not included in that, and I don't know the rationale behind that. I was not a part of those conversations.
Would the city consider shutting down preschools since you have the ability to shut down schools?
I would not recommend that we shut down preschools unless there was a public health reason to do that at this point.
Isn't there, they shut down K through 16 for a public health reason? How can you say there's no public health reason to shut down?
Well, first of all, we have to, again, I was not part of the conversations for K through 12, so I don't know what their logic was behind that, but we know that this disease does not affect children in the same way that it affects adults, and I think our young children need some stability, and so I would suggest at this point, now that could change in 24 hours, but at this point, I do not recommend that preschools or daycares be shut down.
Is there a possibility of a curfew in the city or, restrictions on restaurants or bars, downtown areas?
I'm not sure I understand the question.
A curfew in the city or, implementations on crowds in restaurants or bars if it would get over 100 people?
Well, obviously, declaring, having the board declare this health emergency would then give the powers to the health commissioner to help not just enforce state orders, but other things that she determined to be necessary. I don't think we've contemplated a curfew at this point. And everyone we've talked to, restaurants, business owners, clearly understand the guidance provided by the governor limiting to gatherings of 100, and we expect their partnership and commitment to making sure that's enforced.
Dr. Roberts, could you talk a little bit about testing? I mean, the signs are very obvious coming in here that you're not doing testing here. The only testing being done in the state, as far as we know, is at the state public lab. I guess, do you anticipate a point in time here where you will begin testing?
So let me give some clarity to testing. There are multiple ways that individuals here in Franklin County can get tested. If individuals are sick and need to be hospitalized at one of our 4 hospital systems, they can get tested for COVID-19 at the state lab. I can tell you that our hospital systems are doing testing of outpatients for COVID-19. That started earlier in the week. You have to have a doctor's order, so you have to go through your primary care provider in order to access that type of testing. If you do not have a primary care provider, you can call Columbus Public Health and we will assist you, assuming you meet the criteria. The testing is testing, it is not screening. So if you think you were exposed but you're completely asymptomatic, you are likely not going to get tested for COVID-19. You need to have respiratory symptoms, you need to have been evaluated by a provider, and we need to know that you don't have the flu. So we have to do a test to rule out the flu. Once that criteria is met, then we can get you tested for COVID-19. We could do that all in one setting depending on the situation. Right now, there are 25 individuals in Franklin County that are being in Columbus and Worthington that are being tested for COVID-19. And of those 25, only 3 are at ODH. The other 22 are at private labs in our community who have gone through their primary care provider.
When do you expect those results?
The turnaround time for the private labs is anywhere between 3 to 5 days. That is what they're promising us. I can tell you that the individuals who were tested on Monday, those results came back yesterday. All those tests were negative.
How many was that?
I'm aware of 3 that came back yesterday, but there could have been more.
Can you tell us a little bit more about the public health emergency that you can possibly declare? You talked about how you can tell people to stay home and potentially even have like an officer out front of their door. Is that for anybody in the city, or is that just for public employees?
Oh, no, that's for anybody in the city of Columbus as well as Worthington, not just for city employees. That can be done. But in addition to that, and I think what's really the most important is if we had a cluster of cases, say, at a long-term care facility, which we've seen a lot of concerning stories across the country about that. Under these orders, if I had staff or patients who were saying, I don't want to get treated or I don't want to get tested, I don't think I have it, under these orders, I could mandate that they get tested. I could also prevent anyone from coming into that facility or leaving that facility until they had been appropriately screened and evaluated by public health.
Dr. Roberts, do you know if a similar order has ever been issued in Columbus?
Public health emergency has never been issued to the best of our knowledge from the record keeping that we have.
And is your expectation that the board will go along with it and issue it?
That is my expectation, yes.
So to clarify, 25 people in Columbus and Worthington have been tested, 3 with ODH, 22 are private labs, and of the total, 3 came back negative. Is that correct?
No, I'm sorry, let me be clear. Of that 25, I know 1 in my jurisdiction that came back negative. Her question was the turnaround. I'm aware that tests that were done on Monday came back yesterday. I don't know if they weren't all in my jurisdiction.
Is there anything the city can do to help out, the working parents who, they have kids at home, just businesses that are losing revenue? What kind of assistance, if any, can the city help?
Well, as I said before, this is impacting families throughout the community, including my own. And so, having a 73-year-old father in a retirement community and a 3rd grader that is going to be with us over the next several weeks, I fully understand. But this is about making sure we're doing everything in our power to slow down the spread of this virus. And so specifically to your question, we're going to be working with other service providers in this space, other folks that work on helping to meet basic needs of children and families to do our part as a city. As I had mentioned, the mobile food truck and other things that we're making sure that generally isn't rolling until the summertime. And as you know, we have consistently done a pretty extensive programming and partnerships during spring breaks and during summer with Columbus City Schools and other partners in the community, the county. This is a very different situation and it's going to have to be handled differently. So I continue to encourage employers. We're one of the largest employers here in the community. To be flexible with our employees, to encourage them to use their time to help take care of their families and keep their families healthy and safe. But we encourage other employers to do everything they can to help their employees and the families in this community navigate an unprecedented time and pandemic facing this community and the rest of the world.
And at this time, you're not asking city employees to work from home yet?
No. We are working, our directors are looking at all their employees, whether or not, they could work from home. We're increasing our capacity for folks to be able to work remotely as we speak. And Human Resources and Technology are working on that. So we're preparing, for that, but not at this point. Is that right, Director Brandon? Anything else?
How concerned are you about some of these small businesses in our community are really struggle the next 3 months, possibly longer? We could have businesses not opening up anymore and going out of business. How does a community, how does a city respond to that?
Well, I want to encourage folks. Let's be smart. Let's take care of ourselves and our families. But we've got to continue living our lives and doing business with those folks in our community. So, following the leadership and the orders of the governor, the direction of public health professionals is Dr. Acton and Dr. Roberts, but we cannot stop living our lives. And I encourage folks to be thoughtful, smart, protect themselves and their families, but, get out there.
Any plans to increase police patrols with everything closed? Are you expecting an uptick in crime, like in the summer patrols are initiated?
Well, obviously, we're working very closely with police and fire to look at everything from deployment to coverage, because as Dr. Roberts said, that at any given point in time, it's not a question of, if, but when. And so preparing our first responders, making sure we're taking everything, all the precautions that we can to keep them healthy and safe while serving the public. But we have no indications, there's nothing that is leading us to believe that there's going to be an increase in crime. And quite honestly, I think we've gone about 12, 14 days without a homicide, and we know that there's one this morning. So, I mean, I think what we've seen overall, although we had an uptick in youth violence earlier in the year, if you look at violent crime over the last couple of years, that is coming down, and especially from our homicide rate in 2017, pretty dramatic decreases there. So there's nothing to indicate that that would change during the next couple of weeks.
So you do roll out that food truck. Is there a plan to make sure that people who need it know about it?
Absolutely.
Also, what is that plan?
Well, we don't have it yet. I mean, we're working on it right now. We just learned yesterday that schools were closing. So, I mean, we're going to be working with our other partners in the community, obviously Mid-Ohio Food Bank and other folks that are in the basic needs space, Columbus City Schools, obviously Director Rakowski and his team will be working on that. But I think, to your point, it's going to be about getting resources out to folks where they are in neighborhoods, as opposed to having folks congregate in large groups to meet those basic needs. So it's going to be a different approach, and it's going to require the entire community. Recreation and parks with one food truck is not going to be able to meet the basic needs of this community in the next couple of weeks. We're going to need everybody on board to help.
You mentioned the no water shutoffs. Do you have an idea how many people that affects, how many we have?
I think since the beginning of the year, I think approximately it was 241 for power and 1,080 for water.
That's what it would be over the next 30 days.
Over the next 30 days.
Anticipate over the next 30 days.
Based on shutoffs the last couple of months, the last year or so. So could make a huge impact, especially as we're encouraging folks to wash their hands and take care of themselves and their family.
Dr. Roberts, if you could help us out, we can we can read about logarithmic scale of transmission at 3 to 4% death rate versus a 0.1% death rate, and then try to sum that up in our stories as this is 10 to 20 times more deadly than the flu, and then I get a reader email this morning, you are so irresponsible, there's 50,000 flu deaths and only 20, can you just say on camera why this is an emergency and why this virus is scarier than the flu?
So COVID-19 is a novel infection, an infection that no one in this world has ever seen before in humans. It's not like the flu. Flu we're very familiar with. It's a virus that's been around for years. We know how it operates. It usually starts to show itself in the community in October. We see a peak or anywhere between December and February, and we start to see a decline in cases by April or May. We have a vaccine for it, and we have treatment for it. We know how that infection behaves itself. COVID-19 is something we've never seen before. We have no idea how it will respond with time. We don't know if it'll get worse in the summer months or get better in the summer months. We have no vaccine for it, therefore no one has any immunity to it. Even those of us who don't get a vaccine for flu, which I hope is very few of us, but for those who don't get a vaccine for flu, we all have some immunity to it because our bodies have seen it before. Either we've had it ourselves or we've been exposed to it. That is not the case for COVID-19. So when your body sees this virus, we don't know how most people are going to respond. The data thus far over the last 3 months, almost 4 now that we've been tracking it, shows that 80% will have mild symptoms. But we don't know if the virus will mutate, if it'll get worse. So there's so many more unknowns about COVID-19 than there is about influenza, which for scientists and for clinicians is very concerning, very unnerving, and we have nothing to base our predictions on because we don't have any experience with it.
What is it about COVID-19 that causes the shortness of breath? What does it do to your lungs? Does it cause inflammation? And once you have a vaccine, are there any inflammatory drugs that can help you after you go through the vaccine?
So from what I'm reading from clinical cases, it does cause inflammation of your lungs. It can cause some scarring of your lungs, and in some people, it can cause some fluid buildup in your lungs. Those who get complications, obviously pneumonia is the most common complication for your lungs, which is not unusual for flu too. You can get pneumonia from the flu as well. But usually with the flu, again, we know for the most part how it responds. We can provide those antibiotics if it's pneumonia that responds to an antibiotic. So if it's a bacteria, if it's a virus, we don't have treatments for a lot of viruses, and we have no treatment for COVID-19 other than supportive care.
Should the public read in anything that there's not been a confirmed case, since we're reading nationally about all the testing problems? Yesterday, the state moved from talking about confirmed cases to talking about estimated cases. Do you have an estimated, based on what you're seeing out in the city of Columbus, is there some estimated case number?
So because we started ramping up testing here in our community as of Monday with our local providers being able to test, I am optimistic that we'll get some indication of what the circulation of this virus is in our community. So I am hoping we'll get some cases soon. Again, I can tell you of the 25 that I've tested this week, one has come back negative, but I've got 24 out there that I'm still waiting to see what they have. That will give us some indication. So the fact that we're able to test more increases our surveillance and our knowledge of the virus in our community.
Can you say when you were able to begin testing on a larger scale and what the future testing amounts?
So in talking, I actually just talked to the hospital chief medical officers this morning, and I'm optimistic that by next week, mid next week, all of our hospitals will have multiple locations that people can get tested for COVID-19, again, after going through their provider.
Are you confident of the hospital capacity?
At this point, yes, I am. Our hospitals are well prepared. They work together. We've been checking in about PPE, personal protective equipment. Do they have that? Do they have enough ventilators? At this point, I am. We are working with our Central Ohio Trauma System to coordinate all the hospitals to make sure that's the case. I have not heard of any issues around the state or locally with hospital capacity in Ohio.
Thanks, everybody.